Chapter 2. Providing the right support. Our ambition. 77. We want to make it easier for disabled people and people with physical and/or mental health conditions to access the support that is right for them at the right time. We know that with the right support in place, the opportunity to live independently is more attainable for more disabled people. Improving our reasonable adjustment offer, what you told us. Simplify application forms and make them accessible online. Establish a Tell Us Once service for reasonable adjustment requests, including safely sharing information with charities and other third parties. Provide better training for job centre staff on reasonable adjustments. Improve accessibility of public buildings and infrastructure. Give more practical day-to-day support. What we are proposing. 78. We will transform DWP customer notifications so people can choose how we communicate with them. Once a person tells us their preference, we will be able to share that across benefit services. 79. We are committed to making it easier for our customers to interact with the benefit system. We continue to improve the design of our forms hosted on gov.uk to improve accessibility for assistive software users. We have completed work to ensure all 36 of the most used DWP customer forms hosted on gov.uk are accessible and meet our new design standard. These standards will be applied to all DWP customer forms created or updated as part of ongoing improvements. 80. We are exploring ways to further support people who rely on third parties or carers to manage their relationship with Universal Credit by looking at when people need support, including how people may give permission to others to act on their behalf. 81. We have appointed architects to develop a new job centre design guide so that new and refurbished sites will be inclusive and DWP buildings will be accessible environments for customers, visitors and employees. This will help ensure our buildings better meet the needs of disabled people and people with health conditions, incorporating findings from the Improving Delivery Environments research and learnings from health model officers. We are working with specialist accessibility and inclusivity consultants to ensure the guide meets our needs now and in the future. There is a quotation featured here. The labour market doesn't work as well for people aged 50 to 70 who face a range of challenges staying in and returning to work, including issues relating to disability and health. This age group is a really big untapped resource, and there is a strong argument to be made about multi-generational workforces. We really welcome the 50-plus champions in job centres because they will help employers and work coaches engage better with people in this age group. Kim Chaplin, Work Specialist, Aging Better. 82. The work we did with the National Autistic Society to develop a framework for ensuring that autistic customers of DWP received appropriate and high-quality service covered, amongst other things, the accessibility of the buildings, the signage within them, and the way staff could guide customers to where they needed to be. As noted, we are exploring whether this framework and these improvements can be rolled out across the wider network. 83. The government-backed British Sign Language Act 2022 gained royal assent on 28th of April 2022. The Act recognises British Sign Language, BSL, as a language of England, Wales and Scotland. It also places statutory duties on the Secretary of State for Work and Pensions to produce guidance on the promotion and facilitation of BSL across government and report on government's use of BSL in public communications. In doing so, the Act will promote the use of BSL across government, which will lead to more accessible government services for uppercase D/lowercase d deaf people. Information and signposting that works. What you told us. Provide a dedicated helpline with trained staff to provide information and signposting. Make guidance on providing medical evidence for an application to Personal Independence Payment, PIP, clearer, and make sure people know which services they are being referred on to replace general signposting with referral services. Introduce a one-stop shop to access application information and ongoing support for claims. Improve the accessibility of information and make multiple formats available. What we are proposing. 84. The Health Transformation Programme, HTP, is modernising health and disability benefit services. It will create a more efficient service and a vastly improved claimant experience, reducing journey times and improving trust in our services and decisions. 85. The programme will transform the PIP service from finding out about benefits through to decisions, eligibility and payments. As part of this, we are exploring a case management model. This personalised approach would be available from initial contact and throughout the application, as well as signposting people to other benefits and services. We are still at an early stage in development and will continue to build evidence around the advantages and associated costs. Our new design standards for DWP customer forms will improve accessibility and make it easier for our customers to interact with the benefits system. An enhanced support service for people who need it most. What you told us. Some people find the benefits system difficult to navigate, and independent advocacy services can be important in helping people with their claim. Our service should coordinate with other local and national organisations and help people to access other forms of support beyond DWP, like healthcare. It should offer practical help with benefit applications. It should work with healthcare organisations, social services and charities to identify people who need the service. The service should be co-designed with people with lived experience of disability. What we are proposing. 86. We know people can find the benefits system difficult to navigate. Chapter 3 explains the improvements we are making to make the system easier to use. This includes trialling the continued use of video and telephone assessment and improving transparency. People can also access support through our job centre networks, helplines, or services like Help to Claim. 87. The enhanced support service will not be a universal offer and will, instead, provide targeted help to the people who need it most, such as those who do not have friends or family to support them. 88. We have worked with charities and those with lived experience to understand what further support should look like and have begun testing the new service in Kent. 89. So far, our testing has shown that there are advantages to service users from delivering this through DWP rather than independently. We have seen that an intensive casework model may be able to provide the best practical help to people struggling to navigate the benefit system. We believe this service is better described as an enhanced support service rather than advocacy. We will continue to test whether this model of intensive casework is effective or whether it should be delivered independently. 90. We are now expanding the test of the enhanced support service to Birmingham, Blackpool and Kings Lynn. 91. If the service proves to be successful and is expected to provide good value for money, we will aim to expand it into areas of high demand in 2024. Case study: the benefits of providing enhanced support. The participant, a UC claimant and single parent, had been experiencing difficulties with her mental health. She had run into debt and had begun to ignore her post. She contacted her job centre in distress asking for help. Her work coach referred her to the enhanced support service so she could get the extra help and support she needed. Our enhanced support officer contacted her to offer support and arranged to visit her in a location she felt comfortable with. Together, They opened all her post and prioritised her debts. The officer made a referral to the Supporting Families programme and contacted a debt charity who wrote to her creditors on her behalf. Our officer also supported the participant to get a fit note from her doctor and helped her to complete an application for PIP. When a sudden decline in her mental health stopped her from attending her telephone assessment, they helped her to provide further evidence of the impact of her condition. This resulted in her receiving a PIP award without the need for a telephone or face-to-face assessment. Working with partners to improve people's mobility. What you told us. We should widen access to the PIP mobility component. The previous 50-metre rule of thumb distance criteria used for the PIP mobility component was more appropriate than the current criteria. We should widen access to the Motability scheme and provide more help with transport. The aims of PIP, DLA and attendance allowance. 92. The aim of PIP and Disability Living Allowance, DLA, is to provide additional help with the extra costs of disability to people who are severely disabled early or relatively early in life and who, as a result, have had fewer opportunities to work, earn and save. 93. PIP and DLA are not available to people who newly make a claim when they are over state pension age. However, once awarded, subject to the person continuing to meet the conditions of entitlement, PIP can continue to be paid beyond state pension age. The footnote to this paragraph reads, Personal Independence Payment, PIP, Eligibility, gov.uk, www.gov.uk, available at www.gov.uk/PIP/eligibility. 94. Attendance allowance, AA, is available for people who become disabled after state pension age to help them with the extra costs of disability and maintain their independence. While the intention is for AA to cover the need for care or supervision that an individual may face as a result of their disability, there is no constraint on what the benefit can be used for. Recipients can choose to use their AA to fund mobility aids. 95. We believe the existing range between the age of 3 and state pension age is the right one. 96. Only children aged 3 and over can claim the mobility component of DLA, as all younger children have substantial mobility needs. Children under 3 are eligible for other forms of support, including the care component of child DLA. PIP distance criteria. 97. The enhanced rate of the PIP mobility component was always intended to be for people unable or virtually unable to walk. We believe the current assessment criteria, including the 20-metre rule, are the best way of identifying people whose physical mobility is most limited. The Motability scheme. 98. Motability is an independent company responsible for supporting disabled people with their mobility needs. The department is responsible for the higher rate mobility component of PIP and DLA, which can be transferred to Motability. While the department works closely with Motability, it is an independent charitable organisation that is wholly responsible for the terms and the administration of the scheme. Since December 2021, Motability have significantly increased grant-making and have committed to using £50 million to fund research and insight projects by other charities and organisations seeking to address the challenges that disabled people face accessing transport. The footnote to this paragraph reads, £200 million donation received from Motability Operations, published 14th of December 2022, available at www.motability.org.uk/motability-news/figure 200-word million-donation-received-from-motability-operations. 99. Motability has also committed to fund a new evidence centre for inclusive transport. Conclusion. 100. We want to make it easy for people to access the support that is right for them in a way that works for them. We offer a wide range of financial, health and employment support, and we understand that support needs vary from person to person and from day to day. 101. We will continue to work with partners to ensure disabled people are able to access transport and to ensure that when they do, the experience is a safe and supportive one which supports independent living. 102. We have already done a significant amount to improve access to our services, including the provision of reasonable adjustments, the accessibility of our documents and forms, and increasing the availability of BSL and easy-read versions. There is more we can and will do to transform and improve access to our services, including creating inclusive environments within job centres and ensuring our new and refurbished buildings are accessible for customers, visitors and employees. That is the end of Chapter 2.